Hello future nurses, welcome to another video. Yes, you can master your nursing licensure exam. Today we're diving deep into nursing care for stroke, those sudden brain attacks that can change lives in an instant. We'll explore stroke symptoms, risk factors, anatomy and physiology, emergency response, interventions, pharmacology, and long-term care. And remember, stick around for some next-generation NCLEX-Style questions to test your knowledge along the way. There are 6 in this video, crucial for your exam success, but you'll need to hang out until the end to hear them. Don't forget to subscribe to the channel to access our extensive library of videos designed to help you master the NCLEX. Now let's get started on stroke care. A stroke, medically known as a cerebrovascular accident, is a sudden disruption of blood flow to the brain. Imagine your brain as a bustling city suddenly plunged into blackout. The symptoms hit fast and hard. Common signs include facial drooping, arm weakness, and slurred speech. The classic FAST mnemonic, face, arm, speech, time, reminds us to act quickly. But not every blackout is a stroke. Transient ischemic attacks, or TIAs, mimic stroke symptoms but resolve within minutes to hours. They are like the city's brief power outages, warnings that something bigger might be coming if nothing changes. Risk factors? Think of your body's arteries as highways. Factors like hypertension, hyperlipidemia, diabetes, and atrial fibrillation act like potholes or roadblocks, increasing the risk for a stroke. Poor cardiac health and uncontrolled blood sugar can set the stage for stroke mimics too. Time for your first hotshot NCLEX-style question. There are 6 in the video to help you study. All the answers appear at the end. Be sure to check the description of this video for additional questions. Every yes, you can video has 2 to 5 next-generation NCLEX-style questions waiting for you. But it's hotshot time now. Here's your first. Which of the following is a modifiable risk factor for stroke? Smoking, advanced age, or family history? Hang out until the end. We've got the answer for you. Let's get under the hood. In the brain's grand orchestra, 2 major types of strokes steal the spotlight: ischemic and hemorrhagic. Ischemic strokes occur when a blood clot blocks an artery. Think of it as a traffic jam caused by a rogue vehicle. Hemorrhagic strokes, on the other hand, happen when a blood vessel bursts, much like a water main breaking and flooding the streets. The pathophysiology here is both dramatic and critical. When blood flow drops below a certain threshold, neurons switch from aerobic to anaerobic metabolism, producing lactic acid and ultimately leading to cell death. Conditions like TIA serve as brief intermissions that warn us that the performance could soon go off script. Second hotshot NCLEX-style question. Now, which stroke type is most often associated with a clot and sudden neuronal death? We've got quite a few of these. It might help if you write them down because we'll cover them at the end. When a stroke strikes, time is brain. The emergency response begins with rapid recognition and immediate activation of stroke protocols. Hospitals, especially designated stroke centers, be they acute stroke ready, primary, or comprehensive, are like elite pit crews that streamline care. Emergency personnel perform a quick assessment, obtain a CT scan to rule out hemorrhage, and prepare the patient for potential thrombolytic therapy. Nursing care during this phase involves ensuring the airway is secure, keeping the patient NPO to prevent aspiration, and continuously monitoring vital signs and neurological status. Hotshot. Question time. What imaging study is essential before administering thrombolytics and why? Are you keeping track of your answers? We'll get there soon. Enter the National Institutes of Health Stroke Scale, NIHSS, our trusted tool to quantify stroke severity. The NIHSS assesses everything from level of consciousness to motor strength and language function. As nurses, we use it to monitor changes, guide interventions, and even decide on eligibility for treatments like tissue plasminogen activator, pronounced TPA. Proper documentation and frequent reassessments ensure that if the patient's condition worsens, the team can act immediately. And now, we've got another hotshot question for you. What does a higher NIHSS score generally predict? A better outcome or more severe deficits? Answers coming at the end. Once we've identified the stroke and ruled out hemorrhage, immediate interventions kick in. For ischemic strokes, the golden ticket is TPA, a thrombolytic that dissolves clots, restoring blood flow if given within 3 to 4.5 hours. Dosing is weight-based, so accuracy is key. Alongside pharmacologic interventions, nursing tasks include monitoring for signs of intracranial hemorrhage, managing blood pressure, and performing regular neurological checks. If TPA isn't an option, mechanical thrombectomy might be considered for large artery occlusions. In both cases, precise calculations are critical for dosing and infusion rates. Think of it as mixing the perfect recipe where one mismeasured ingredient can spoil the dish. Let's go for another hotshot question. For TPA to be most effective, within what time frame must it be administered after stroke onset? We'll reveal the answer shortly. After the acute phase, our focus shifts to post-intervention care and rehabilitation. Patients transition to a stroke unit or intensive care where nursing interventions aim to prevent complications such as aspiration pneumonia, deep vein thrombosis, and skin breakdown. Early rehabilitation is crucial. Physical therapy, occupational therapy, and speech therapy become key players in the recovery journey. Nursing care emphasizes helping patients regain independence in activities of daily living, from feeding to personal hygiene, while adapting techniques to address any residual deficits. Patient education is vital. We teach clients about lifestyle changes, managing blood pressure, controlling blood sugar, adopting a heart-healthy and diabetes-friendly diet, and incorporating regular exercise. These measures not only prevent recurrence but also improve overall quality of life. Our long-term care plan includes patient and family support, as stroke recovery can be a marathon, not a sprint. Final hotshot. Question time. Which time-sensitive window is crucial for the administration of TPA in ischemic stroke? We'll get your answer in just a moment. Now it's time to test your knowledge with some hotshot NCLEX-style questions. Ready? Let's go. Which of the following is a modifiable risk factor for stroke? Answer: smoking. Which stroke type is most often caused by a clot resulting in sudden neuronal death? Answer: ischemic stroke. What imaging study must be performed before administering thrombolytics and why? Answer: a computed tomography scan is essential to rule out hemorrhagic stroke, as TPA could worsen bleeding. A higher NIHSS score indicates what? Answer: more severe deficits and a higher risk for poor outcomes. Within what time frame must TPA be administered for optimal effectiveness? Answer: ideally within 3 hours, but it can be given up to 4.5 hours after stroke onset if criteria are met. That wraps up our deep dive into stroke nursing care, from recognizing symptoms and risk factors to emergency interventions and long-term management. Remember to like, comment on, and share this video and subscribe to the channel.